there are moments in therapy when maybe it's a silence for 5 minutes. The client is feeling something and therapist is there just empathizing with the client. So 5 minutes of no talking, but the most important healing happens in those 5 minutes. No words are exchanged. So with this example, you can see how it is very different from talking to a friend or a family member.
Hello and welcome everyone to a brand new episode of Coach for Mind, India's first mental health podcast. Our vision is to reduce the stigma around topics like mental health, depression, anxiety, counseling or therapy so that you don't feel alone and you realize that all of us are going through something or the other for which we need love, support and understanding. And we are here to provide you that right guidance and understanding that you need in your journey and that of your loved ones. And to do that, today we have come up with a pretty interesting topic because we feel that this is a question that many people go through. Because we hear a lot nowadays in YouTube videos or ads where people talk about counseling, that how we should seek the help of a mental health professional so that we can go ahead in our journey of healing and actually understand and accept or deal with our situations. But many people are confused. They have questions that will it really help me? Or what will I gain out of it? Or what even happens in that room? So people get scared. Sometimes you have to push people inside the room of a mental health professional so that they go ahead and seek the help. Because all others around them can see it, but they cannot because they are too scared. And to answer all your questions that you have in your mind, that you have ever encountered regarding therapy or counseling, we have with us none other than Mr. Lekh Bajaj, who is the founder of this podcast and a licensed clinical psychologist himself for the past 7 years. Welcome, sir, to a brand new episode of Coach
Thank
for
you,
Mind.
Riti. I'm so glad that we are doing this episode because this is like a mystery box that we are opening. And even when I myself sought counseling for the first time, I also saw that room like a mystery box. We don't know what will happen. There was anxiety, excitement, curiosity, all these mixed feelings. So I think today we'll answer some of the questions around what happens in a therapy room.
Yeah, definitely. And this will help a lot of people to understand it themselves and to even show it to the people around them, to the people that they care about and who care about them. Maybe it's our parents also who are not very used to these terminologies. So it will help them to give that understanding to the people around
As
them
you talked
as
about
well.
parents, it reminded me of like a common term कि बात करने से क्या होगा? बात तो हमसे कर ले. Yes.
Yeah, so true. People don't understand that what's the importance of this. And I guess this is going to be an enlightening episode for a lot of
Sure.
audience.
Yeah. Let's move ahead with it.
Yeah. Sure, definitely. So I'll straight away dive into the first question. And it is actually, I want to know your perspective about it. We later go on to how a person who is trying to go or thinking of going into therapy, what he should do. But before that, when you are seeing someone or seeing a client for the first time, you as an experienced psychologist know that people have lots of questions in their head and they're dealing with their issues and they are going to be coming to you for help, somewhere scared, somewhere confused. So what is your mindset when you're seeing a client, a person for the first time? What intentions do you set before you go into that first session with a new client that you have never seen before?
Yes. So a very important question, and so there can be multiple ways. Maybe different professionals might use different ways. So I'll share my way of doing it, and this I have developed like over the years. This is how I start the first session. Like you mentioned, setting the intentions is very important, so that me and the client are on the same page before we like take even a single step into the therapy. So I usually talk about 5 different aspects. Again, very briefly, not that it takes a lot of time. First and very essential is to clarify that the therapy space is a non-judgmental space. And like I explain them why it is important, and they can share about anything and everything, be it about their personal life, interpersonal life, even whenever they are comfortable, even their deepest, darkest secrets as well. And again, the importance of the same, that if they feel, because mental health issues are always coming from the deep within, not at the surface level problems. So talking about deep things, very vulnerable emotions, they might feel like crying. So all those can be talked about. Obviously, every client expresses, opens up at their own pace, but and sometimes like some of my clients remember that first statement, that it's a non-judgmental space. They mention it maybe like 8 to 10 sessions later, that it really helped me, that one statement, that it's a non-judgmental space. So that's how I like start the first part. And second, which again is equally important, is confidentiality, that whatever they share, be it very personal information or professional information, therapy is 100% confidential, and nothing that they share with me I'll ever be speaking to anyone else, not even to anyone that I know of. Even if I have to share it with, suppose, another professional, let's say they are also consulting a psychiatrist, that also I'll first take their permission and then share. So that also comes like a very a relief for a lot of clients, that it is, whatever I'm sharing is safe with the therapist. And third is, I again, because sometimes, and I think some of our audience might also need to understand, that therapy is not a magic pill, suddenly something like after the first session everything will change. So it's a process. So I think that's where I set the intention, that you will see the changes, but it might not happen in the first session. You will start to see slow changes after maybe 2-3 sessions, and again, it's a little longer process. So that setting that intention, and mostly clients already know that, but still to mention it, that don't expect any sudden change in the first session. So that's again very important. Fourth, I mentioned to them about the regularity of sessions, that we might meet once a week or once in 10 days, and not to miss any sessions. In case they miss, try not to take too long gaps between consecutive sessions. And this again is also important, because again, it's a process. We are like building momentum, and if at any point there is a long gap between 2 consecutive sessions, we might lose that momentum. So again, certain clarifications about this. And then if they, like the client has any kind of questions, then I offer them that take your time and ask if anything of any kind that you want to ask. And then we start with like talking about the problem itself. So yeah. So this actually helps the client to first become comfortable with what's happening.
All right. There's a little side question here that I have. When you mentioned about confidentiality, all I know from my experience about therapy is what I've seen in web series. So, like, as psychologists, like, do you keep notes of that particular client which you can share with other psychologists upon his approval later on? So, do you maintain notes for each and every client?
So, every client, every session, notes are maintained. Earlier, maybe, I don't know how, like, senior therapists used to maintain notes, but these days, like, we upload it online in a safe, again, a password protected space. So otherwise, earlier there used to be like files of each client and set of notes.
Yeah. All right. Okay, that's actually beautiful. I think every therapist has his own these first session intentions that they set, or the particular system that they follow. Is that so?
Sometimes it maybe some psychologists get too technical about it, but I prefer to keep it more of a human thing, that they don't feel that it's something like a checkbox के ये follow करना पड़ेगा, ये rules है. I rather talk about things which are important for the client.
Okay, that's beautiful. So, like, with time, like, as a person gets familiar to the space of therapy, how does your approach for treatment changes as you get deeper in the therapy process with your client?
So again, it varies from client to client and problem to problem. There is no fixed approach, but still, if I have to give a general guideline, so there are 2 directions in my mind when I am as sitting there as a therapist. One is what we refer as symptomatic relief. कि symptoms हो रहे हैं, let's say बहुत sad feel हो रहा है, बहुत anxiety हो रही है, या relationship में बहुत extreme problems है. First one direction is that we have to address the like immediate relief लाना है. Second is to address the root cause जिस वजह से symptoms आ रहे हैं. So these two directions are there. Depending on client की feeling में कितना ज़्यादा pain है, या if the client is too overwhelmed, then first we focus on symptomatic relief, then go into working on the root cause. Or if the client is not in so much pain, emotional pain, then it both goes in hand. And in fact, we use, at least this is how I do, I use two different approach to psychotherapy. Maybe we can talk about both these in detail in some other video. One is cognitive behavioral therapy, which is very good for symptomatic relief, and the other is psychodynamic approach to therapy, which is very good for deep work, addressing the roots of the problem. So again, not going too much in detail of these two. So these are like two perspective in mind, and depending on for example, some client might see immediate relief after 1 or 2 sessions, then we very easily can go into deep work. And also deep work is not always mandatory. It again depends on the client. If they want to explore deeper parts of their personalities, then we go ahead. It is helpful for the long run. But sometimes people are like कि मुझे बस ये problem solve करनी है, that's it. So we go with that.
So does that happen? Like without addressing the deeper aspects, is it possible to solve a problem that might be genuinely
if it's
troubling
not too
them?
deep of a problem, for example, someone is stressed about their job. So we only address it at that level and not go too deep into the personality factors and personality patterns.
Okay, right. True. So now let's move on to the client's perspective. Suppose I'm deciding to take a therapy session and I have no idea what's going to happen in my first session. I'm a little scared and I want to know that what can I expect from my first therapy session if I come to you now?
So a lot of time what happens is because like in therapy, the client gets an environment where they can speak very freely without any much filters and very freely express, and they sometimes get very vulnerable. They feel like crying, they cry, and that comes like a huge relief to them. Like even in first session, they feel like their burden, like they just put down their burden, and relief, they feel relief after like maybe few months or sometimes many years. So sometimes that happens within the first session, although that I'm not saying that the problem is solved. It's just a relief after a long time since you are carrying the burden of the problem that you're facing. So they feel that relief. It can happen, but again, I would say that don't expect it must happen. If it doesn't happen, doesn't mean that therapy is going bad.
Yeah.
Sometimes, again, it varies from person to person, problem to problem. So again, in the first session, as a client, they can expect to feel some of this relief. It can be huge relief also for some client, but some relief everyone feels. Second part is they get a space where they can talk about anything and everything, again, in a very non-judgment free, and like they don't need to be afraid of any kind of consequences. So that they can expect. Another thing, what happens in the first session is more of a orientation into the whole process. They get to, like, whatever questions they have about therapy, they get to ask those questions and clarify if they want to, and also understand what process they are getting into. So they also get clarity about it. But again, another important factor of therapy is insight, that you get insight into why you are facing this problem. That sometimes you get some insights from the first session itself. Sometimes you get insights about the problem later on into the process.
Okay. So, there's this one question that I've always had personally, that what is it that what is that special thing that happens inside a therapy room that can genuinely help a person heal their issues? Like, are these the questions that you as a therapist ask your clients, which forces them to find their answers and to get the insights, as you mentioned? Or, like, what are the helpful tools of therapy and how do they help someone to actually heal themselves? Like, what is that special thing? Because I can talk to a friend, like that's what people say. You
Mhm.
can talk to us also. Why do you need to go to a therapist? So, what is different about therapy that will help me to actually gain those insights and move ahead?
I think that's a beautiful question, very important. Second, I think while answering this question, I'm like sharing the insider secrets. like, uh,
Ooh.
so basically,
Okay.
again, I'll answer it in three different parts. So, and some of these things might get a little too technical. So again, like, so you might need to, like, even the audience might need to have some patience. If something doesn't make sense, they can ask in the comments and we can address those later. So years of research showed that what helps in therapy or what improves the patients is the therapeutic relationship, the relationship that they share with the therapist. Obviously, it's a professional relationship. It's not friendship. It's not any other relationship. It's a professional but a therapeutic relationship, which has three components to it. One is empathy. Second is genuine interest. Third is unconditional positive regard. And these three, I'll explain these three in detail a little in a while. But these three actually are found to be the most important parts of therapy. Let me explain. So when I say genuine interest, so when you share with a family member or a friend, they are already maybe preoccupied with their certain things. कि मुझे ये करना है and जल्दी से बोलो. Yeah, they might feel, because if you are sharing something very really sad, it will evoke sadness in them, and they might get uncomfortable with their own sadness and might not be willing to listen. So a number of things can be there, but therapist is there genuinely concerned about what problem you're facing, and the whole focus is on you, what you're feeling, what you're thinking, and how to address those problems. It's not about the therapist ke fatafat say what solution can I give, what advice should I give, which happens in the cases of friends and family. So that genuine interest is there, which, like, for example, if a session is of 1 hour, one person, a professional, is sitting there absolutely focused on you for that 1 hour. And hence, it's not just another conversation. Second is empathy, which is the root tool the therapist uses to solve the emotional pain, which is to understand that, okay, this person is feeling this way, and being with the person in that feeling and helping them realize that together over time we can contain these painful feelings and we can work through it. So a person is with you in those feelings. Again, it's not that if you're feeling sad, a friend would come and he will listen to you or maybe give some advice ki ye kar le, or let's go party. So that none of those is empathy.
Yeah.
Therapist ka main tool is empathy. They will sit with you, help you first to understand what you're feeling, what can we do about it, how to cope with those feelings, how to contain them, and then move forward with some solutions and insight, which solutions comes much later. First step of healing is empathy, to know that there is someone who is understanding what is going on inside me, even at times when I am not understanding what's happening inside. Someone who has studied this, understood it, and he or she can help me to look into it and see what I am feeling and how to cope with it. And third part, which is absolutely magical, is unconditional positive regard. Sounds a little technical, but in very simple terms, even our parents give us conditional positive regard, or you can say conditional love. कि तुम इतने मार्क्स लाओगे then you are good, otherwise you are bad. हमारी बात मानोगे then you are good, otherwise you are bad. But in therapy, whatever you have, whatever you are, everything is regarded as positive. No matter how deep, dark, painful it might be, in every moment, the therapist is there with you. There is no judgment. There is nothing to be ashamed of. And this third one, unconditional positive regard, when it is given over time in the therapy sessions, it actually like changes things, because root of the mental health problems
Wow.
are rooted in our early childhood experiences, in how we experienced our parents, our important people when we were growing up. And most of the problems like depression, anxiety, and even relationship issues, how we uh, feel as an adult, are coming from the roots. Again, how we experienced it, very, it's like एक प्लांट के रूट्स में बचपन में जब वो सीड था तब उसे क्या मिला था, वहां से वो आगे प्रॉब्लम्स आती है. एंड इन थेरेपी वी as therapists provide them a healthy attachment with the therapist, which again, this knowledge is not available to the like common public, that this is what happens in therapy. And this at times is a very subconscious process. Even client doesn't realize it, even sometimes therapist doesn't realize it, but the work is happening because you are getting, you can call it again, when I use the word love, not the romantic love, but unconditional love in therapy. No matter how painful you are feeling, there might be certain things that you are too ashamed of. In every step, you are given positive regard. You are not looked down upon. You are always considered that you are important. And that's one of the very important factors of what heals people in the long run. And obviously there are certain tools and techniques which comes under cognitive behavioral therapy. Those are also absolutely important. There are certain techniques of working on your thoughts, working on your feelings, which are also taught like outside, which a person can practice outside of therapy. But again, first I talked about the deep work, and this is also a symptomatic relief work.
Yeah. Wow, that was so beautiful. I had no idea that this aspect of therapy actually heals people. People think it's that you're going to talk to someone. Like, how good can it be? Like, what can it do to you? Like, what is the difference? But the way you talked about the qualities and the values in that relationship that you like impart, the empathy, the unconditional positive regard, that is so beautiful. And just hearing about it makes me realize on a good level that yes, of course, it can heal anyone if someone actually gets to experience that in an accepting atmosphere that a therapist creates for
And
his
just to give you
clients.
another example, there are moments in therapy when maybe it's a silence for 5 minutes. The client is feeling something, and therapist is there just empathizing with the client. So 5 minutes of no talking, but the most important healing happens in those 5 minutes. No words are exchanged. So with this example, you can see how it is very different from talking to a friend or a family member. For example,
Yeah,
client is just
I can
crying
totally.
and therapist is just there, and like that's the very core work that happens. And again, it doesn't happen like it happens over time. First of all, that therapeutic relationship is created, that space is created jahan pe client can become that vulnerable. And when
Yeah,
you are accepted
that's
with the
true.
deepest of the pains and scars that you have, and that actually heals.
Yeah, that does heal. Even that sounds to be such a healing power. Do you think that if a therapeutic relationship can be so beautiful because the therapist has those intentions in mind that he has to accept the person, the client totally with unconditional positive regard? Do you think any relationship where two people come with these values within themselves can be a beautiful
Absolutely.
healing relationship?
So some of these qualities like empathy, being genuinely interested in the other person, if these qualities are present in a friendship or a relationship, that friendship or a relationship itself is healing. It heals.
Yeah, that's beautiful. I guess this message
And just
everyone
because
can
that
take
is
today.
lacking in the
That we can,
society, we need to go to therapy.
yeah, that's one aspect too. That's true. After such a beautiful answer, I would like to move on to one question that one of our viewers asked about therapy. That he mentioned that there are two things that people are scared of, or maybe they have questions about when they move to therapy. One is that they feel that maybe they don't have that much time because people are working, they're quite busy these days. So, how can they maintain, as you mentioned, the
Mm,
regularity of of those sessions? The other thing is, how do they recognize if the person, the therapist that they are going to, is efficient enough to be able to help them in their
mm,
with their issues? So, like these two things, I guess, stops
mm,
people at a certain level. As you mentioned, not everyone might have the approach that you are talking about, and it might not be good for it's not
mm,
like everyone needs that. Maybe some people need
mm,
different kinds of approaches. So, how can someone decide or like go past these questions and actually go through a
mm,
session to
mm.
feel that
So
healing?
to answer the first part of this question about the time required, so it it usually it's like one session in a week. So taking out 50 minutes or 1 hour for yourself in a week, especially for the emotional part of you, I think at least that much we should be able to take out. Otherwise, we are so occupied with the outside, the work, the people, the social life. So, coming back to yourself, talking about yourself, expressing the deeper you for 1 hour a week. First of all, I think that much should be given. Like, you deserve that much time for yourself. Second, even spending that 1 hour would like take away a lot of moments of anxiety and painful emotions, which itself will increase your productivity and give you much more extra time in your throughout the whole week. So from that like perspective, it's not it's always like you gain time rather than you lose time.
I think it's similar to workouts,
Yes,
as people say. If you can't even take out 20 minutes every day, then your
yes,
body won't be able
yes,
to work
like
that
have to
productively.
attend to our body,
Similar
attending
to
to
that.
our mind is also important. Second
Hmm.
part of the question also, yeah, so you also talked about in the first question that therapy can be a longer process, so it varies from person to person and problem to problem. Sometimes people are stressed, and those can be addressed in very few sessions, as few as 4 5 sessions. Sometimes people are depressed or have
Hmm.
some anxiety disorder. Those issues can be addressed in 10 to 20 sessions, again roughly once a week frequency. But then there are deeper issues like
Hmm.
personality disorders or very deep rooted problems. Those can go on for years as well. So it's not that therapy is
Hmm.
always long term. It varies from person to person and problem to problem. And again, like I mentioned, that mental health issues occurs because of years of like bringing up in a certain emotional environment. And obviously genetic factors are also there, but how we grew up affects our mental health as an adult. But so you can imagine, you have lived a certain way for 18 years, uski wajah se some problem is coming. How can we expect it to resolve in 5 hours or
Hmm.
10 hours? So
Yeah,
definitely time,
true.
it takes time. It's not a quick fix. And whatever quick fixes are available, they will give temporary relief, but again, might not address the root cause. Yeah.
Hmm. True. And this question
Uh,
about efficiency of a therapist, like how does a person
So
know?
again, what I have recognized, because most of my clients come from word of mouth. Like I worked with some client in the past, they refer it to someone, and mostly word of mouth is much more reliable than, let's say, you Google something and find someone on some random platform. When it comes to medical science, it might be okay because it's just that you have to give a medicine and every doctor is trained to give them that medicine. But in therapy, therapist is also part of the medicine, so to say. So how the therapist is
Yeah.
as a person is extremely important. So again, like what clients look for is trust factor, that can I trust the therapist. So Best is if someone can refer you to a therapist. If, let's say, a friend of yours, a relative of your family member of yours has been to a therapist and they had a good experience. So that is always, mostly that works pretty well. But even otherwise, if you, let's say, find someone online or get to know about someone, so uh, like best you can do is you can read about them, ask them for their profile, their past work, maybe their testimonials if previous clients. Again, this is again a second priority, but if still you don't have any reference, then you can read and watch and get to know about your therapist as much as possible. And I think I would encourage therapists also to share a lot of information, again not personal but professional information about themselves, so that client can find, like, can trust you, that they've, because with that information at least you start to build some level of connection and trust. So that is a second thing. Yeah, mostly this, because eventually it's about, at least in this profession, it's a lot about whether you can trust the person or not. And if there is trust, if a therapy starts with a feeling of trust, then the recovery is much faster. Otherwise, initial few session goes into building the trust. But again, a disclaimer
that's
would be,
true.
at least in India, again, I might get some hate comments for this, but I know a lot of psychologists who might not be providing very good quality work. They go too much into the books, what the book says, and then they lose the human connection of it. So that's a tricky part. Why? Because if a client enters therapy and after 2, 3, 5, 10 sessions, if they realize it's not working, to restart it with someone becomes really painful and difficult. To again trust someone, again revisit the same things all over again. So yes, it's a difficult decision to commit to one therapist. So it's a responsibility for therapists also to provide for the trust that client is putting on you.
It sounded like when someone comes out from a bad
Yeah.
relationship and they have all
Yes.
those scars, then it gets
Exactly.
a lot more difficult
Like
to
I
trust
mentioned,
someone
it's a
else,
therapeutic
their
relationship. It's
emotions.
not just, okay, it's a professional relationship. It is therapeutic.
Yeah, true. That was beautiful. A wonderful episode that I can say is going to impact lots of people, solve so many questions that people must have in their heads, and maybe encourage and inspire them to go ahead and try something, try to take a step ahead and seek mental health professionals' help and experience that healing that they can in that beautiful environment of acceptance and unconditional positive
Absolutely.
regard, as you mentioned. Yeah. So, I would like to tell all of you that if you like this episode, which if you took anything from this that actually inspired you and impacted you in a positive way, do like this video and subscribe our channel for getting all the notifications for all our upcoming videos, because we are going to bringing a lot of wonderful content for you which can help you in your journey and that of your loved ones towards healing and growth. And if you need any help of any sort, don't hesitate to reach out to Coach for Mind for your help and for that of your loved ones. And do follow our Instagram page and LinkedIn for further updates. And if you have any questions, don't forget to comment in the comment box. Have a good day and bye bye.